Now, one of the most common symptoms that patients with dizziness or vertigo will come and tell us is the feeling of imbalance. Either the room is spinning around, or they will feel like as if they're in a boat, or they will feel lightheaded. There are many causes of dizziness or vertigo, as it's most commonly called. You can actually classify that into peripheral and central. In simple sense, the peripheral are basically nerve related and or balance organ related in the ears. The central are could be from the brain related, so either a ischemia or a stroke in the brain or multiple sclerosis. Patients will have central vertigo or central dizziness. Whereas in the peripheral, the most common cause is BPPV, which is basically benign paroxysmal positional vertigo. In simple sense, these are small calcium micro crystals that get dislodged from the balance organ, and they start to stimulate the hearing cells and the balance cells. That gives you a sensation that you're moving, whereas the rest of the body says you're not moving. For instance, I can close my eyes and I can move my fingers. I know how many fingers I'm moving. I know where they are. How do I know that? I can't see them. I can't hear them. And the reason why I know where they are is because there are receptors on your joints in the entire part of the body that is constantly sending signals to your brain as to where you are. Now, if the brain is getting a signal that's either abnormal or that is in out of sync with what they're used to getting, the brain gets confused, and that's what the dizziness is. The treatment for dizziness is simple. You try to find out what's the inciting agent, or what is the inciting cause, or the root cause of the dizziness, and then you treat that root cause. In patients who are taking multiple medications for blood pressure, they will have what's called postural hypotension, which means you're sitting, you're standing up, your blood is not able to maintain the pressure, the blood drops down, less blood goes to the brain, and the brain then stops those centers for balance and for a few milliseconds, and that gives you the dizziness. So we make sure that your blood pressure is under control, you're well hydrated. Now, other thing that helps in patients with dizziness is what's called vestibular rehab exercises. The physical therapist will work with you and kind of teach you a lot of these vestibular exercises. One of the most common and the most easy to do that can be done at home, and that works in 80 to 90% of the patients, is you take a soft object or a tennis ball. Basically, you keep it in your hands and you throw the ball up and down, and you track the ball. Throw the ball left and right, and you track the ball. By doing up and down, left and right, you may get dizzy. If you get dizzy, what I want you to do is stretch your hand out and stare at your thumb for a few minutes until the dizziness goes away. So by doing this, these receptors are telling the brain, hey, we are not moving, we are right here. And by focusing with your eyes on this, on your hands, your eyes are telling the brain, hey, these guys are not moving, they're right here. And any other signal that the brain is getting, the brain will forget to process that, and you will eventually start to feel better. The more you do this exercise and bring on the dizziness and then overcome it by doing this, the faster you will get better. Most patients who have dizziness, they realize that by making certain head movements, they get dizzy, so they stop doing those head movements. If that happens, you become like a robot, right? You can't do anything, you can't go out, you can't talk to social gatherings, you can't drive. You don't want to do that. So once again, it's a very simple exercise. You take a soft object or a tennis ball, you throw the ball up and down, you track the ball, you throw the ball left and right. You get dizzy, you stretch your hand out and you stare at your thumb for a couple of minutes until the dizziness goes away. You do this for 5 minutes, 3 times a day. In about 4 to 6 weeks time, most patients with dizziness will see a significant improvement in the symptoms.